it's not just a two-tier system. They got a lot of different tiers. One physician who has left his career out of disgust over what he saw during the so-called COVID plague. He said people were treated as if they were dirty plague rats if they were not vaccinated. This is a physician, Dr. James Miller, who has set up a Substack, but he just recently did an interview with Alex Mayer. He said that the unvaccinated were treated as dirty plague rats. He said hospitals were actually nothing more than killing fields. That's what we've been saying from the very beginning. So they're killing people with ventilators. They're killing people with remdesivir. The people who are dying in the hospital. They refuse to treat people unless it's going to be a vaccine or a ventilator or remdesivir. They turn people away. He said he started seeing that. He was disgusted with that. So he was a Christian. See, that's a key thing here. He was a Christian. And so he worked with his pastor to set up free medical care. He said he had a guy at church tell him that he had a chronic condition and they refused to give him any medication or treatment for it. And he said, I couldn't believe it at first. But then he said, I looked at it and it was actually happening. He said they started just denying basic health services to unvaccinated people, which spurred not giving diabetes medicine to some of them. He said you could still get emergency care in the ER, but you were 100% treated differently. You were treated as a dirty plague rat, and this was common in social media, but it was no different in the hospital. The medical community is no different. He said the Overton window has shifted now since the pandemic. People realize the medical establishment is not what they had previously trusted it to be unquestionably. And so now people are looking at the mask is off, and we have seen the ruthless self-interest of these corporate hospitals. And that's what he's talking about here. He said after COVID, most people realized their doctors were there for themselves. And quite frankly, it is the corporate takeover of these hospitals, massive networks of for-profit hospitals. But of course, the message for the doctors that are there is that you play along with this or you're out. And so the doctors really are doing this out of their own interests. He said most people came to see that the hospitals were really killing fields. The shift has been pretty dramatic. I felt that shift in 22 when I was still working as a trauma surgeon. He said soon after COVID hit, suddenly our hospital outcomes and our quality data became hidden and opaque to us. He said prior to this, data was openly shared and we even discussed it in quality assurance meetings. In other words, they would say, okay, so here's the situation that happened and here's the results. What could we have done better? But now with this, they hide everything. He said the hospital forced upon us a narrative that was pure lunacy and contrary to all available observations and previously available data. It was just rampant corruption. So I said from the very beginning, all these people who are defending Trump, all the MAGA cheerleaders, well, it's not Trump, it's the bad Democrat governors. It's like, no, Trump is bribing everybody. He's bribing the governors. He's bribing bad Republican governors who are doing this, but especially bribing the hospitals. And again, if we go back to August of 2020, I'll never forget seeing the American Hospital Association. Its initials are AHA, and it was an aha moment to see that the CMS, the people who basically reimburse hospitals for Medicare and Medicaid, that they were offering a 20% bonus of everything the hospitals did if the person was a COVID patient. So you can understand that if you're not a COVID patient, get out of here. I need to save these beds for somebody that's going to be identified as a COVID patient so I can get that 20% bonus. And that was in addition to if they just pointed a finger at somebody and said, you got COVID, they got, at that point, they got $13,000. They got $39,000 as a reward from Trump if they put somebody on a ventilator to kill them. It's just unbelievable corruption that was happening with it. Of course, as long as you were surviving while they're in the process of killing you, they could charge you enormous sums for using the ventilator and then get a 20% bonus on that as well. When a local newspaper's headline blared, "Local ICU Overwhelmed" in April of 2020, Miller told his colleagues to, quote, laugh at the morons writing this paper because the hospital that was the focus of the article had never been overfull. He said, I knew we were in serious trouble as a medical community when clinical leaders started believing the words in a newspaper and hospital administrators more than their own eyes and their experience. Well, did they really believe them? Or did they use that as an excuse to do what they wanted to do, which was to comply with this, go along with this, to kill people for money? It was about the money. The love of money, the root of all evil, the love of money, the root of the pandemic, folks. It couldn't have happened without the bribery.
If you give people an incentive and then give someone a plausible way out, well, maybe it's not happening here, but that hospital over there, it's probably true there, so we're going to take precautions. It lets them soothe their conscience a little bit. Well, we're making, we need this money so the hospital can stay operational. It's really helping us. We're doing the right thing. It's not just to enrich ourselves.
That's right.
It gives them this little bit of good feeling they can rely on.
That's right. And so you had a lot of doctors, a lot of scientists who were saying, why are they drawing a hard red line and telling people you can't try ivermectin or hydroxychloroquine or any of these other things, anathematizing that, kicking people out of the medical profession for prescribing those types of things, which had a long safety profile. They were just prescribing them for off-label use, which has always been allowed in the past. And so that raised a lot of questions of people in the medical community. But if you're looking at this from a political, historical standpoint, it was crystal clear from the beginning. It was to me. If you knew anything about Dark Winter, you knew that they'd practiced this very thing every year for 20 years. And when you look at what they did after 9/11, that was the first one, was 2 months before 9/11. A week after 9/11, they have the anthrax attack, and 2 months later, they push out model legislation to all the states so the states could do it. They didn't want to have it directed from Washington because that'd be a violation of the 10th Amendment, and it would be challenged and shut down. So what they did was they encouraged the states to put these processes on the books, and then they bribed them from Washington, which is what they always do. They do that about everything. They do it about boys in the girls' bathroom and boys and girls' sports. One side will bribe the states to do that. The other side will bribe the states to not do that. But that is the common method. They all understand that. They all use the Federal Reserve's phony monopoly money, which there is an endless supply of. They use that to bribe the states. And it's just a question, we would play the game of scruples. After we went through a few rounds, we said, we keep getting the same types of questions over and over again. They're just changing the dollar amounts here, right? What is your price? At what price will you sell out? At what price do you throw your scruples under the bus? He said, now watch as every policy practice and quality metric that makes a trauma and surgical program a good patient outcome was undermined or abandoned by my colleagues and by the hospital administration.
It reminds me of that old joke, A guy walks up to a woman and says, hey, would you sleep with me for $1 million? And the woman says, yes. And the guy says, well, would you sleep with me for $10? She says, what do you think I am, a prostitute? Says, we've established you're a prostitute. We're now just haggling over the price.
That's right. And so they haggled over the price, but they came in with $1 million offer to start with. And the hospitals eagerly said, yes. He said, I found out that all the major healthcare systems in the country had agreed to this action, and that they drove the creation of the policies and demanded physicians act in direct opposition to their oaths. He said, I departed at that point from the medical community in spirit. And so he said, with the help of his pastor, he went on to create a free clinic at his church to care for those who had been ostracized from society. That's exactly what happened. His clinic patients, he said, were met with maskless smiles, with prayer, with support, and with free medical care. Sometimes, he said, people would be waiting in my driveway for me when I arrived home the early morning after a night shift or late night after I had finished a day shift. So what became obvious as the most important thing about our clinic is that our patients needed to be treated as valuable people created in God's image. Folks, this is the basis of a civil society. It is certainly the basis of America's civilization. The idea that we are created equal by God, and as a result, we should be treated equally. We should not have multiple tiers. We should not have the two-tier system that they have in the UK. We should not have a system, as you have being promoted now by many Christians. Oh, well, they're the chosen people. They get to commit murder, start wars. they can execute children. It's okay. We'll give them a pass because they're special. They're better than everybody else. That is a fatal flaw to any society. The common man. They created Common Core to dumb down our children. They created Common Pass to track and control us. Their Commons Project to make sure the commoners own nothing. And the communist future. They see the common man as simple, unsophisticated, ordinary. But each of us has worth and dignity created in the image of God. That is what we have in common. That is what they want to take away. Their most powerful weapons are isolation, deception, intimidation. They desire to know everything about us while they hide everything from us. It's time to turn that around and expose what they want to hide. Please share the information and links you'll find at davidknightshow.com. Thank you for listening. Thank you for sharing. If you can't support us financially, please keep us in your prayers. davidknightshow.com.